My name is Claudia Trenkwalder. I'm from University Medical Center in Göttingen and Paracelsus Elena Clinic in Kassel. And I want to give you an overview about motor off periods in patients with Parkinson's disease. So there are several options of treatment. And before off periods really start, patients often suffer from wearing off. That means a reduced duration of efficacy of levodopa treatment before the next levodopa pill is taken and starts. Then off periods with more tremor, rigidity, and hypomimia start. There's an akinesia during the off, motor impairments. During walking, there occurs often freezing, and they can have a duration of minutes up to hours during daytime or nighttime. Usually there's reduced quality of life during these off times and during the entire day. They are most uncomfortable situations for people with Parkinson's disease and are often underestimated by caregivers and even doctors and neurologists. There are several strategies to treat these off periods. One can increase the single dosage of levodopa, but only until dyskinesias may start. Then there can be a reduction of the intervals, one can split dosages, or one can add further medications. The International Parkinson and Movement Disorder Society has published an evidence-based medicine review about the efficacy of these treatments for motor fluctuations. One can, for example, add a dopamine agonist, either in a sustained release formulation or sometimes even better in a transdermal way. One could add a COMT inhibitor or safinamide or racetyline. These are all efficacious medications to treat off periods. Amantadine had not yet sufficient evidence at the time this review was published, but there is now more evidence. So I want to give you some examples from recent times with new trials. Opicapone. This is a COMT inhibitor with a once daily use. The off time significantly improved in this study compared to placebo and was similar compared to entacapone. But as this is a very long-acting drug, even 9 hours after administration, still 90% of opicapone was active. So a once daily dosing 1 hour before or after levodopa is sufficient to improve off periods. One has to carefully check if oral treatment is still sufficient when off periods increase for duration and maybe severity. Sometimes then one has to switch to continuous treatment options with pumps like apomorphine or LCIG or surgical options. There's a recent study with apomorphine in a continuous subcutaneous way. And with this continuous infusion pump, one could reduce the off times and also increase the on times without troublesome dyskinesias. So the duration of on time significantly increased, and with this also quality of life increased. The side effect of this treatment are mostly local skin nodules in some patients, so one has to watch out if these side effects occur. But it is a good option to switch if the oral treatment is no longer sufficient. Another option, if apomorphine is not tolerated or is not sufficiently efficacious in some patients, is the LCIG, continuous infusion of levodopa carbidopa gel into the jejunum of patients with Parkinson's disease. And for this treatment, we also have now some long-term data that show that especially those patients who have off periods with a duration longer than 3 hours benefit from this treatment, even after 2 years. So there are 86% of patients with an off time more than 3 hours who had still a good effect after 2 years. If these treatments are maybe not appropriate for patients, and this patient is still a young Parkinson patient, even at the age of 50, 60, but at least under 70, surgical treatments may be an option. According to this evidence-based review, bilateral DBS in the subthalamic nucleus and in the GPI are both efficacious treatments for motor fluctuations in off periods. And they are both rated as clinically useful. It is important to differentiate between patients, which patient is one who may benefit from a pump treatment or from surgical treatment. In general, younger than 70 may benefit from surgical treatment if especially the motor symptoms are the most troublesome problems in the patient. There's also quality of life improvement after subthalamic stimulation for Parkinson's disease, and a recent meta-analysis showed that in many studies there was a significant improvement after 6 months, and this improvement lasted also for 5 years. After 5 years, the scores are often back to baseline before surgery in patients, as they then need additional increase of dopaminergic medication. Important to know that all ages benefit from SDN DBS independent from the disease duration. One has to advise patients, however, that also surgical methods are not a cure for Parkinson's disease, but they benefit for the symptoms, especially the motor symptoms and the off periods, also for dystonia, quite a lot, and are significant improvements. So to conclude, there are several options for treating off periods. Oral medications like adding dopaminergic medications, but also continuous pump treatments and surgical methods. One has to decide which method is appropriate for which patient. In general, first, medical oral medications followed by either pump treatment or surgical methods for patients under 70. Thank you for your attention.